1. We are live now.
Good evening, everybody. Welcome again to this webinar brought to you by the Orthopaedic Research and Education Foundation, India, along with relayed through OrthoTV. And today, again, we have the pleasure of Dr. Amir Maroof Khan from Delhi, who's going to talk to us about planning statistical analysis and what are the best tests that you should be doing, statistical tests that you should be doing for a particular sort of a situation where you have to try and get your statistical values into your paper or thesis or whatever. And this is always a confusing thing for most people, and it will be really enlightening to hear Dr. Amir Maroof Khan on this. So over to you, Dr. Amir.
Thank you, sir. Before I begin, I will share a link of a paper that is an open access paper on Dr. Bhadani's mobile, so that he can put that link on this Zoom message box also for everyone to access.
Excellent.
Good evening, everyone. This is a short session on planning statistical analysis. This is the time when all the postgraduate students all over the country are writing thesis protocols. And the section that is there in the thesis protocol you have to write is about which statistical test will you be using in your thesis. With acknowledgements of my seniors, I have named here, I move ahead with the presentation. So the contents of this session are basically, one is the basic biostatistics. You should, after the session, you should be able to know how to decide which statistical test to use for the objective that you have in your study. And we will be talking in short about the case record form because your data comes from that. So just making the participants understand some basic biostatistical terms and concepts for the planning your statistical analysis. And you have to write it in your research protocols also. We have to start with the first point, that is variable and versus data. So what is a variable and what is data? Variable is any entity for which the value, any characteristic, any parameter for which the values can change from one participant to other participant in your study. For example, if you look at here, you'll see age, blood group, gender. If you have two types of surgeries being performed on a patient, then type of surgery, because that is also may change from one patient surgery type A and another patient surgery type B may be there. If you have socioeconomic status, that will also be a variable because not all will be from the same socioeconomic status. And on the other side, you have data. So variable is what you know at the beginning of your research, that is what are the variables in your study. And data is when you start collecting the data, the value you get from measuring, from recording by asking the participants. For example, here given is age and the data about age and the data about blood group. You always talk about that we are collecting our data is collection is still remaining. So data is always collected from the participant either by doing some test, some measurement. So that comes later. But at the beginning, you must know about the variables that are there in your study. Exact number of variables you should know that is there in your study. So for example, let us say I am doing a study in about burden of traffic accidents reporting to orthopedics department of my college and hospital. So the name of the hospital, will that be a variable or not? That is a question to you all. Dr. Janki, can the participants type in the message box yes or no? Is it
Yes, sir.
possible for them? Okay, so will the hospital, name of the hospital be a variable or not? That is a question, yes or no. I would request those who are watching this right now, if you can write. So burden of road traffic accidents being reported in orthopedics department in our hospital. That is the study I am doing.
I have not received any reply, sir.
Okay, so the question is, variable is something that there should be a possibility of change. It should vary from one person to another person, one participant to another participant, and from one patient to another patient. So if you are studying maybe 20, 100, 40, how so many you may get the patients in the hospital. So the name of the hospital, is there a possibility of it being changed from one patient to another patient? No, because all the study is being done in one hospital only. So name of the hospital is not a variable in this particular research. Now, another example I can give you is about you are doing some study on something related to prostate cancer. So there you have to keep in mind that gender, will that be a variable or not? So if only male, because males, in only males you'll be finding this. So again, gender will not be a variable unless and until you are wanting to include like transgender, and there are other categories where this can be there, or you are only wanting to do as a study on males, or for that matter some ovarian cancer and all related to that. So only if it is being done only in women, so women will not, the gender will not be a variable in that case, because there is no possibility of that particular variable to change from one patient to another patient. So that is a variable, and data is what you get by collecting the information from, as you can see on this slide. Next, we move on to types of data. What are the types of data? So there are many types of data that you must have read about, like categorical data, nominal data, ordinal data, ratio data, interval, scale, and so on and so forth. In the statistical world and the practical scenario, we basically consider two types of data. One is categorical and another is continuous. So for all practical purposes, this works fine. In some cases, you may need to take some other types of data, but very, very rarely. So for the time being, focus only on two types of variables, that is categorical and continuous. So let us look at these examples. The first one, blood groups. This is a categorical data because there are categories of blood groups. Gender again is a categorical data. Pain intensity, you see here, mild, moderate, severe. It is a categorical data. One may say that, and rightly so, that this is ordinal data. Mild, moderate, severe. This seems to be, there seems to be an order, and there is an order here. So it's an ordinal data. But when you analyze it, how you are going to analyze it? So when you analyze it, basically you are analyzing it as a categorical data only. So for the purpose of statistical analysis, this will be considered as categorical data. For theoretical purposes, ordinal data is perfectly fine. But when you do statistics, you have to consider it as categorical data. Now, in some cases, pain intensity, mild, moderate, severe, and you can also have a 10-point scale. Pain intensity scales are there, 5-point scale, 10-point scale. So if you are planning to measure pain in scores like 0 to 10, so in that case, pain, you are using the 0 to 10 scale. So, so for some patient, you are getting like score of 2, for some you are getting score of 5, 10, 8, 9, whatever. You will find, and then when you are doing like that, you will find out mean pain scores in one and mean scores of in the other group and all. So in this case, you are using pain as a continuous variable. So please remember that in ordinal data, there is a catch that if you are using it as a mild, moderate, severe, or there are 5 categories and you are considering these categories separately, then all these are then you are considering it as categorical data. And if you are intending to use the scores, then it will be called as the continuous data. So when you are planning your statistical analysis, at the research protocol stage itself, you must be clear and mention it in your research protocol whether this particular, for example, here pain intensity, this variable will be considered as a categorical variable or will it be considered as a continuous variable in your study. It's not that one is right, another is wrong, both are correct. It's just in ordinal scales, you can look at it both ways. There is a possibility, but that you have to specify at the beginning of the research. It must not happen that at the end of research, once you do, and then you say, let me try to do it by categorical test, statistical test, let me try it by that also. And from wherever p-value is significant, I will consider it that. That is a wrong approach. That is like you are fishing for p-values and it will not be considered as a correct science. Then weight, height, all these are continuous variables. Number of students in class, number of beds in wards. So continuous, we'll say they are all continuous. They are integer values. So continuous data and categorical data. So for the statistical analysis purpose, these two types of variable one must be clear about. So this is two types of data. Even though you know many types of data on a theoretical level, that is fine. As you move on, maybe sometime you might use some advanced statistics, ordinal type of data in a separate way, but mostly this is sufficient. Now, let us understand, in order to understand about which statistical test to use, we should have a command about certain concepts regarding our data. So here there is we are starting with some concepts which will help you later on to decide which statistical test to use. So here you see there is a weight of some students given in a particular medical college. Now, if you look at this, but this is what type of variable is this? This is a continuous variable because weight is given. So the continuous variable is there. Now, whenever we have a continuous variable, so we know at the thesis protocol stage or research protocol stage that this variable weight of students or any other group that you are studying, that is a continuous variable. Now, that is why when you know that this is a continuous variable, you also know that when you will complete your data collection, how are you going to present this particular variable to the readers? How are you going to write this particular data in your research? So this continuous variables are presented as means and standard deviations. So in that case, we have to decide first the type of data. So in this variable that is their weight, so this is you will get a continuous type of data, and then there is a mean and standard deviation. Usually you present by that. So there are two concepts here: central tendency and measures of dispersion. Central tendency, you have got mean, median, mode, and when there is a continuous variable, you will write mean or median. Mode is not used in statistical tests, so you can forget about mode for the time being. What you use in statistical test, when you have to decide which statistical test you have to use, you have to know what type of distribution pattern is there, whether mean is applicable in that particular for that particular continuous variable, or whether median is applicable for that particular continuous variable. How to decide that, we will come to know in a few minutes. So here you see this example given here. So the value of mean is around 63 and median is around 64. So they are nearly similar, 63, 64. And now we are adding in the same group 2 more students' weight. Now the mean of the weight has shifted to towards the right extreme, that is higher side, and that is 70 here. What is happening here is that the moment extreme values are there, then the mean shifts and it doesn't remain a measure of central tendency. In such cases where there are extreme values in data, data is tilted to one side or the other side, then we can't use mean and then we use medians. So we say if the mean and median are nearly similar, then we use the normal, we say the data is normal. And why it is important to identify this is because if the data is normal, then the statistical test that you decide will be different. And if the data is not normal, then the statistical test you will use will be different. So normal or not normal, you can easily decide that by seeing, that is a rule of thumb. You can just see the mean and median. If you see the mean and median, and if you find that mean and median are nearly similar, then it is a normal type of data distribution. And if you see that mean and median are apart, much apart, then it is a non-normal distribution, because then medians will be compared. In some cases, it may happen that mean and median, they may be different, but you may not be able to say with confidence that they are really different or not. Here it is 70 and 65 in the non-normal, so it is different. But in case you think that you further want, you can apply tests of normality that is there in most of the statistical softwares. So you can apply test of normality to find out whether the data distribution is normal or it is not normal. But most of the times we find that just by looking at the data, mean and median for that particular variable, we identify that they are nearly similar or they are much different. So we have, we know that by looking at the mean and if we have some value of some particular student, then we can understand how much away from the mean that student is by looking at the standard deviation. So standard deviation and is there an interquartile range? There are two things. Just as we saw in the measures of central tendency, there were two values. Either you will be using mean in case of normal distribution. If the distribution is not normal, then you will be using the median. Similarly, if the data distribution is normal, then the measure of dispersion that is used is standard deviation. If the data is not normal, then you use the interquartile range. So I will just help you recap this particular concept. It is very important to understand that when I say normal or non-normal, you don't need to draw the histogram and see. You can do that. But if you don't have the histogram and you are not able to find out from the histogram and all, you can just look at mean and medians. At least mean and median values are available with you all. So look at the, so for any continuous variable, what you do is you calculate mean, calculate median, calculate standard deviation. Calculate these three things, and then you will be able to get an idea, a preliminary idea, whether your data is normal or whether it is not normal. So depending on that, you will be deciding your statistical test. Let us now move on to standard deviation. You all know this, that standard deviation tells us about the spread of the data in that for that particular variable, and 95% of the values fall between plus and minus 2 standard deviations. Now let us look at the same example of weight of the medical students. We find here that standard deviation was 6.87. And then when we move ahead, we have the standard deviation. So how much distance is there between the mean and the particular value that we want to find out. Now, if on the left side, you see normal distribution, as we have seen in the earlier example, this is the same data that we are using. And in the non-normal side, you see there are two extreme values because of which the mean shifted towards the right side. Again, if you look at the standard deviation in the left side, you will find that standard deviation is 6.87. And in the non-normal side, you will find that standard deviation is higher. So what happens, in non-normal distribution, and when I say non-normal, mean is not equal to median, they are far apart. And standard deviation is also not the correct method of knowing the dispersion in the data. So just as mean fails to be a measure of central tendency in a non-normally distributed data, similarly standard deviation also fails to be a measure of dispersion in a non-normally distributed data. So in that case, just as when the mean is not applicable in a non-normally distributed data, you use the median. Similarly, for the dispersion, you don't use standard deviation, but you use the interquartile range here. So interquartile range, what is done is you arrange the data in an ascending order or a descending order. So here we have arranged in an ascending order, and then you divide it into 4 parts, so equal parts. So the first cut is put at Q1, second is at 25% you put one cut, at 50% you put another cut, that is Q2, and at 75% you put another cut, that is Q3. So you divide this whole data into 4 parts. These are 4 quartiles, we say. So you are dividing into quartile. First quartile is from till Q1. Q1 to Q2 is second quartile. Q2 to Q3 is third quartile, and above Q3 is the fourth quartile. 4 quartiles are there. So interquartile range is Q1 to Q3 is the interquartile range. So whenever you have to present your data that is not normally distributed, you are finding there are extreme values in the data, mean and median are not near to each other, then you report median, and then you report along with median, you report the interquartile range. So this is how you report. So this you have to be clear before the start of your study only, that which are the variables which are continuous variables. And you should know that for continuous variable, when the data will be collected, after that only you will come to know whether that data will be normally distributed or not normally distributed. Beforehand, we can't tell. So what happens at the planning stage, when we are planning a study, at that time we most of the times we take this into consideration that data will be normally distributed, and we write the statistical test for that normal distribution data only, as we will be seeing later. So you write that, and later on, if you find that the data is not normally distributed, then you use the statistical test for non-normally distributed data that is allowed to be changed depending upon the data that you have got. Okay, so this is not applicable here. Confidence interval and standard error of mean is not applicable for deciding statistical test that you do later when you are getting the data. Now, after the continuous data, let us have a look at the categorical data. Categorical data, you have got, you are presenting it in the form of proportions only. So no confusion here. It will be in the form of proportions. like in continuous data, you have got lots of things, mean, median, standard deviation, interquartile range, depending upon whether it is normally distributed or not normally distributed. But in categorical data, plain and simple proportions. There is no concept of normally distributed, non-normally distributed. So only proportions, whatever type of categorical data is, you will present it in the form of proportions. Categorical data, but nonetheless, continuous data is also used a lot. So whenever you are presenting the proportions, you have to report the absolute numbers. As we see in this example, somebody said that operative success for a very complicated procedure is 100%. Now, we don't have absolute values here. So the once we know the absolute values, then we are clear. So here we see there are only 2 surgeries of that kind was done, and both they were success, but we don't know what will happen when that particular surgeon will be doing 10 surgeries or 50 or 100. How many? What will be the success rate? Will it be 100% or is it going to change? So it is important that whenever you report proportions, you report the absolute values also. So this is a summary. What type of data is there for that particular variable, whether it is continuous or whether it is categorical. So this you have to be clear about your variables when you are starting your research protocol, because based on this only you will be able to decide which statistical test to choose for your particular objectives. So continuous and categorical, just remember these 2 type of data. When you use statistical test, why are you using a statistical test? You are using statistical test to be sure of some result that you have got. For example, here I mentioned drug A is said to lower the blood pressure. In orthopedics, you have various types of surgeries which can lead to facilitate the activities of daily living. So, or there may be the movement may be better, the range of movement may be better, the pain may be less, blood loss may be less. So there are different variables are there. So you want to find out whether surgery A or surgery B, which is better. You will get some information from your data, but whether it is statistically significant or not, or you need to do a statistical test. That is the importance of a statistical test. Without that, if you don't use the statistical test, then you don't know. It may just have happened by chance. That is one of the risks that is there. So that is what actually later on, whichever statistical test you use, you decide to use, later on what will come out is a p-value. Whether you are using chi-square or whether you are using ANOVA or whether you are using t-test, you'll always find that you'll get a p-value. And if the p-value ranges from 0 to 1, if it is higher or it is like 1, then the whatever difference you are seeing between 2 types of surgeries or between the 2 drugs that are given, then this particular difference that you are getting is because of chance only. If the p-value is 0, then the role of chance is very less. When the role of chance is very less, or luck factor, we say whatever difference you are seeing in this particular study, that is because of luck, just you are finding it's statistically significant and drug A seems to be working here. But remember that statistical significance does not mean clinical significance. For example, you are testing the change in the pain scores of patient, and you are by doing 2 types of surgeries. So in one you are doing surgery A, in another you are doing surgery group, you are doing surgery B, and then after that you are comparing the pain in the 2 group. Now you find that the statistical difference is statistically significant or not, and you find that it is statistically significant, and you are happy that this is statistically significant. So that means surgery A is better if the pain is less in that group. Surgery A is better. But you must also look at the clinical difference that is there. That is, if the score, the difference in the scores, pain scores in the two groups is like in one it is 6 and in another group it is 5 or 5.5, very small difference. So you might find that clinically it is not meaningful. Then the statistical difference you find by statistical test loses its meaning because we don't want to promote a surgery which it may be more costly, it may be, and it is reducing the pain just by 0.5. The score of 0.5 is maybe meaningless in your particular study, the scenario that you are studying. But yes, if in certain cases, even the score of 1, if it is different, it is clinically meaningful, then it is important that you focus on that. So always look at the difference in a between the two groups in a clinically significant way also, and that the doctor and the physician and the surgeon, they only can decide this, that whether it is the difference is clinically meaningful or not. Statistics will just give you p-value. So you have a hypothesis always, and when you have a hypothesis, then only you have a statistical test. If you don't have a hypothesis, then you don't have a statistical test. So here in this case, what we saw that drug A does not decrease the blood pressure. That was a null hypothesis, and alternate hypothesis is drug A decreases blood pressure. So effect of one variable, that is a type of drug, on another variable, that is a blood pressure. So here you see there are two variables. One is drug, type of drug, and another is the blood pressure. And type of drug is categorical variable, and blood pressure is the continuous variable. So you are comparing the blood pressures. So what variable you are comparing? You are comparing a continuous variable in the two groups. So blood pressure in one group and blood pressure in another group. So you have to compare continuous variable. This is important because this will help you to decide which statistical test will be applicable for this particular hypothesis. So here, because the p-value is less than 0.05 or less than 5%, so we reject the null hypothesis here in this case. So data, here this is an algorithm that will help you to decide which statistical test you have to use. So we started with the categorical and continuous. Why we started with what is categorical and what is continuous variable? The reason was this, that the first step when you have to decide which statistical test will be applicable for your research objective, the first step you have to decide is what variables are you going to compare. If you are going to compare categorical variables, then you have to go on the left side of the algorithm. If you have to compare continuous variables, then you have to go on the right side of the this algorithm. And then if you look at the continuous side, the right side of the algorithm, further down the line from continuous to, let me see if I can use a pointer here. So continuous, so if it is a continuous type of data, you go on this side of algorithm. And then you have to see, when you have a continuous variable, I told you that find out the mean, median, standard deviation. And if you find that the mean and median are similar, then what will happen? Most likely it is a normal data. So you'll go on this side of the algorithm. But if you find that the mean and median are wide apart, then you go on this side of the algorithm. So it is important that at this point you stop, check your mean, median, and standard deviation. Another way to decide whether you have to use normal test or non-normal test is that you can see the mean and standard deviation. If the mean is 3 times or 4 times of standard deviation, So suppose if your mean is mean systolic blood pressure is 120, and standard deviation you are getting is suppose it is 80. Now 120 and standard deviation is 80. So standard deviation is quite high. Standard deviation should be less than 3 or 4 times of the mean. In a normally distributed data, we always find standard deviation is very less than the mean, less than 4 times of the mean. In some books, it is mentioned 3 times. In some places, it is mentioned 4 times. So 3 or 4 times, it is fairly okay to say. So if you find that the standard deviation is less than 3 or 4 times of the mean, then you go towards the normal data. If you see that the standard deviation is high, or then you go to this side, that is the non-normality side. Then further down, so this is how you decide. You are deciding the statistical test using this algorithm. Always, I will recommend you always use this algorithm to decide the statistical test. You will never go wrong. Then when you have the normal data, then you move ahead, and if there are 2 groups, you go on this side, left side. If there are more than 2 groups, you go on this side. So stepwise you have to decide. First step is you have to decide the type of data, whether it variable that is categorical or whether it is continuous. Depending on that, you will use you will go further down the algorithm. If it is continuous, then you have to further see whether it is normally distributed or whether it is not normally distributed. And then later on, whether it is 2 groups or more than 2 groups that you are comparing. So if you're comparing and it is 2 groups only, then you have to also decide whether it is paired data or whether it is unpaired data. So what we see is there are many things to be decided, and we have discussed all these concepts here. We have discussed categorical continuous, we have discussed normal, not normal, 2 groups, more than 2 groups, you already can decide. What we have not discussed till now is paired and unpaired data. Now, what is a paired data? That we have to understand. If there is any study where you are measuring some continuous variable, and that is before and after the study. So if it is before and after type of study, before giving the particular intervention, what was the particular mean value of a variable, and after the intervention what was, and you want to compare these two, before and after, then it is a paired data. There is one more place where we say there is paired data. That is when you are having to, if you have a case control study where you are doing matching, there are 2 groups and you are matching. For example, age and sex matching is one of the common variables that are matched in a study. So if you have in your research protocol, if you mention that there will be matching in the 2 groups, whether it is age and sex matching or some other socioeconomic status matching or neighborhood matching. So if you have some type of matching in the 2 groups, then you will use the paired paired data test. And if it is if it is neither a before after study nor there is mention of matching in your study, then it will be the unpaired data. So paired and unpaired data, you know now how to decide. Based on that, you will arrive at the statistical test. So keep this particular algorithm in mind as we go on, as we move ahead. You will have to decide which statistical test you will use for that particular objective using this algorithm. You may know by memory also, you may have learned that for certain for your MCQ exams and all, you know that if you see some terms there in the question, then what option you have to check and what will be the answer quickly, even without using any algorithm. But that is not the correct way. For entrance exams, it's okay. But in when you have to apply it in real life, you should be sure of the things. It should not be just some magic trick that you are using to arrive at the answer quickly. So we will come back to this algorithm again when we see those examples. So here, what statistical test will be used in this particular case? So this is first question. So this is a data that you expect that you will be getting. So which statistical test you will be using. So if you know that you have to compare the blood pressure before and after medicine. So right now you might have come to the conclusion immediately based on your earlier memory that whenever there is before and after, you will immediately will write that, okay, this particular test will be used. But no, we will use the algorithm. That is where we have to start. So for this particular example, how will you use the algorithm? So the first question in the algorithm was, that is, what is the type of data that you are comparing? Okay. So the type of data that you are comparing, blood pressure you are comparing, blood pressure, systolic blood pressure before and after. So systolic blood pressure is a continuous variable. So what will happen is we go to this side, continuous side. Now, next is we should know the normality of the data, whether it is normal or whether it is non-normal. Let us go to the example again. What we see for blood pressure before drug and blood pressure after drug. So we have mean and median of the blood pressure before drug, and we have mean and median and also standard deviation of the blood pressure measurements after giving the drug. So we have got mean and standard deviation and median for this column, and mean and median and standard deviation for this column. So if we find that this and this both are normally distributed, if the mean and median are similar, then we will be using the normal test. So in this case, so let us, for example, for the sake of convenience, we say that the mean and median are similar and it is normally distributed. So you will go on this side, that is normal data. How many groups are there? There are 2 groups. And whether it is paired or whether it is unpaired, because it is before and after study, so it is paired data. So you arrive at this conclusion that the test that you will be using is a paired test. Even though you might have been knowing this answer in the beginning itself, but the point is not about whether you arrive at the answer correctly. The point here is whether you are able to use the algorithm or not. Use the algorithm, you will be more confident about your data and you will be able to understand statistics further as you move ahead. Now there is another example. There are 2 groups. One is placebo. In another group, there is for the other group of patients, there is some drug that is being given for the systolic blood pressure. So what you are finding is, again, what statistical test will be used in this particular type of data. So if you have such an example, so first thing, again, use the algorithm. So what type of variable is this? So you see, what type of variable it is? You are comparing systolic blood pressure again, so it is a continuous data. So for the sake of convenience, we are considering that it is normally distributed. We have checked that. So we will go on this side, and then there are 2 groups, and it is not before, after, and no matching has been mentioned. So we will be considering it as unpaired, and that is why you will be using student's t-test in this case. So again, this particular example, you find out. So here it is unpaired t-test will be applicable in this case, considering that the data distribution is normal in both the groups. Now, which type of which statistical test we will be using for this? Even though you might be knowing the answer, but the point is how to use the algorithm. So first of all, decide which type of variable is this. You are comparing the presence of a thrombus in the 2 groups, placebo and the aspirin group. So presence of thrombus, what type of variable is this? Is it a categorical variable or is it a continuous variable? So this is a categorical variable because thrombus will be either present or whether it will be absent. So it is a categorical variable. Whenever there is a categorical variable, what happens is that you go to this side, categorical side. Now you can either use chi-square test or you can use Fisher exact test. There are 2 tests mentioned. Mostly chi-square test is used, but in some cases where you find that the values in these cells are very less, then you use the Fisher exact test. Now, how much less it should be? Actually, the this is a 2x2 table, as you all know. So these are observed values: 18, 7, 6, and 13. These are called as observed values. Whenever you are going to apply chi-square test before applying chi-square test, there is a thing that is done in the background by the software also, statistical software also. Or if you have to manually calculate chi-square, then also you have to do something. That is, you have to find the expected values in each of the cell. So here you are get 18, 7, 6, and 13. These are observed values. For each of these cells, you calculate the expected value also. I'm not going to discuss here how to calculate and all those things, but it is calculated at the background, expected value in each cell. And if any one of these 4 cells, the expected value is less than 5, then we use the Fisher exact test. Now you will ask, we are not calculating expected values, then how will we know whether we have to use chi-square or Fisher test? So the easy answer is that whenever you will be using the statistical test using any software, most of the softwares, they give you a footnote when they calculate the chi-square test. They give you a footnote mentioning whether the expected values are less than 5 and in any of these cells. And if it is, then it will also flag at times that this chi-square may be inappropriate in this case. So whenever you do a statistical test using a software, keep tab on the footnote of the result output that you are getting, and that will help you. We never calculate expected values and check. That is not what we do. Now let us see what type of data is this. Height of 22 students were more than 160 centimeter, and there were 18 students whose height was less than 160 centimeter. So what type of data is this? Is it categorical data or is it continuous data? So we know that data, when we say height is usually continuous data. But in this case, what has happened is, here there's a cutoff used, that is more than 160 centimeter and less than 160 centimeter. Because of that, this height is now considered as a categorical variable. So for example, hemoglobin. Now, if you are using cutoff of some hemoglobin for anemia, and then you are using hemoglobin as anemic or non-anemic, then anemia status is a categorical variable. For height, for blood pressure also, if you are using systolic, diastolic blood pressure, whether you are using it as means, the continuous variable, or whether you are taking some cutoff to find out whether it is hypertensive or non-hypertensive. Similarly, for BMIs, obesity or non-obesity. So you will have to be careful that the variable that you are mentioning in the research protocol, whether it is categorical, you will be using it in a categorical way or a continuous way. So if a continuous variable, you are using some cutoff, then it changes to categorical variable, and then you have to go towards the chi-square test. So there's a set of values given which represent central value better. So you can see that the values are near to each other, but at the end you see that there are some extreme values. So whenever there are extreme values, the mean shift towards one side, that is extreme side, and then median is better. Mode we don't use. Now we will be yes. So this is another example. Now doctor conducted a study to confirm role of particular medicine in anemia. Now he recorded the hemoglobin of 100 patients before giving iron therapy and after giving the iron therapy. So what type of statistical test you will use here? Again, first decide what type of data is this. So what this is hemoglobin value. So it is a continuous variable. Go towards that side. Then you see whether it is normally distributed or non-normally distributed. Considering for the time being, most of the times it is normally distributed. So you will go towards that side. And there are two groups. So, and then it is before and after. So it is paired. That is why if you look at this particular algorithm, always go to algorithm, see what is the type of data, continuous or categorical, normal and non-normal, and two groups or more than two groups, and whether it is paired or unpaired, and then you will arrive at the. If it is non-normal, then it is paired, then we'll Coxon sign rank, and unpaired, then Mann-Whitney U test. So you use the variable, it will be helpful for you. And this is the example. So which statistical test you use here? Again, first decide what type of data is this. So diphtheria present or diphtheria absent, vaccinated, not vaccinated. So this is categorical variable. Whenever you are comparing categorical variables, you use the chi-square test. Just in short, we will also see the case record form. You make a case record form to enter your data in that. So there are some basic guidelines. It should be easy to read and follow it, and easy to fill. It should be self-explanatory. It should not be like, don't leave anything to assumption. It should be such that if you give it to anybody else also, they will fill the same type of information. And don't collect too much of data that is not required. Always focus on your objective. Depending on the objective, you decide what data you have to collect. Don't collect extra information, and don't collect less information also. Like if you have your objectives, then all your objectives must be met by that data. Please check on that before you move ahead for data collection. And don't have it quite like a booklet type of thing for your thesis especially. But in big research projects and all, you use booklet type of things also for data collection. But for thesis research, we don't recommend that. So let us look at type of questions. Now, duration of cuff. Now, duration of cuff is a variable. Every question that is there in your case record form, every question is a variable actually. So because the answers can vary from one particular participant to another participant, that is why every question is a variable. So duration of cuff is a variable. Now, if you have to put duration of cuff in your case record form, whether you will write in the way it is written on the top or whether it is written below that. So there are two ways in which you can capture the data. Whether either the first one, duration of cuff in weeks. Here we are writing in a raw data, whether it is 1 week, 2 week, 3, 4, 5, whatever, we're writing that number. In the second example thing here, you are seeing duration of cuffs in weeks. Here it is pre-categorized, I will say, less than 2 weeks, 2 to 4, 4 to 6, and more than 6 weeks. So which is better? The first one is better or the second one is better? So the first one is better here. Always collect the raw data. Later on, you can categorize however you want, how many were less than 2, 2 to 4. Because if you collect this in this format, and later on, if somebody asks what was the proportion of how many people had patients had a cuff less than 3 weeks, or what was the mean duration of cuff in the patients that you have studied. Now you cannot find out the mean from this. Categorical data will never give you the mean. And if you have to see some other cutoff like 5 weeks, 3 weeks, you cannot get that from this particular data that you have collected. So always collect the data in a raw format. Later on, do the categories and all that stuff. Let us look at another example. Site of lesion in a particular disease like intestinal tuberculosis and site of lesion. So there are. So which is better, the first one or the second one in this case? I told you have to collect the raw data, but in this case, there are not more than these many options. The options are fixed. So in this case, the second one is better. Because later on also, you are not going to see some other cutoff and see. So it will be these 5 categories only. So then in this case, the second one is better. So if your data, if your variable is categorical variable, then you collect the data like this. If your data is a continuous variable like cuff, weight, height, BMI, all those things, then you collect the raw variable. Later on, you apply cutoffs and decide. Similarly, it is good that you have boxes and all made in your questionnaire itself. And you have the codings also in your questionnaire itself, male 1, female 2. So you can just 1 or 2, you just write here. So you can just tick here, checkbox. You can check in the relevant checkbox. And why it is good that you write 1 and 2, because when you will be doing the data entry at that time, you'll know that you don't have to write male or female there. You just have to enter the code that is there for that particular option. So finally, when you write in your research protocol, the statistical analysis section, it looks something like this, like data will be presented as mean and standard deviation for normal and non-normal data. And when you write this data will be presented, you mention the categorical variable. Here you mention the continuous variable that that will be presented as mean and standard deviation. And continuous data will be compared using students unpaired test or this test. So whatever test you are going to apply, for which variable you are going to apply which test, it is important to know that. For continuous data, so for continuous data, you have to identify which are the variables that are continuous variable in your study and which are the variables for which you are getting categorical data. Depending on that, you will write. And then p-value of less than 0.05 you'll consider statistically significant, and that is one paragraph that you write. So this is a generic template. You will modify and adapt it for your objective for your research protocol. So that's all from my side. That was a short session on how to choose the statistical test. Use the algorithm that will help you, and the paper that I have shared, that also you can use. Dr. Janki can share it with participants, and that can be used.
Thank you so much, sir. Sir,
Thank you.
we have a few questions which usually the DNBs or the MS student usually have. Is that, as you have explained, that if we can divide it between categorical and continuous variable, it is quite easy. Still, sir, there are some tests which, like paired t-square, paired t-test or a student t-test, and another what you have explained in that one, sir, for paired t-test, sir, which is usually most commonly used. So can you elaborate on that, because you have mentioned it is for continuous variable?
Yes. For continuous variable, whenever you have to compare continuous variable, then you use the unpaired t-test, and unpaired t-test is also called as student's t-test. Whereas if you have a before after study where you have to compare the continuous variable in a before after study, or if there is matching present, then you will use the paired t-test. So either you use paired t-test or you use unpaired t-test, depending upon whether it is a before after study or matching is there or not. And unpaired t-test is also called as student t-test. So the name is different, but otherwise it is one and the same thing.
So usually in orthopedics thesis, it is about the functional outcome of any surgery, if it is given, which is one of the most common one, and the result is specified as a satisfactory or unsatisfactory. In satisfactory, there is two category like excellent and good, and in unsatisfactory, fair and poor.
Yes.
So for that one, sir, what is the common test which we can use?
Yes, that's a very good question. Level of satisfaction is usually when you collect that information, it will depend on what scale you are using. So if you are using a 5-point Likert scale from 1 to 5, the score range from 1 to 5, and you intend, so 1 is like no pain at all, and 5 is like very severe pain. So 1 to 5. Now what happens is, if you say that you are going to sorry, no, not pain, satisfaction level, 5 is very satisfactory and 1 is highly unsatisfactory. So what happens is, if you are thinking of using this information in the form of satisfied or not satisfied, by taking the cutoff as 3, so it ranges, the satisfaction level ranges from 1 to 5. So you say that if the score is above 3 for a particular patient, you will say that it is satisfactory. If the score is 3 or less than 3, you will consider it not satisfactory. If you are going to use your satisfaction level information in that way, then it will be used in a category. You are using it in a categorical way. Satisfactory or not satisfactory. Then you will use chi-square test. So you will be comparing what is the proportion of patients who are satisfied by surgery A, what was the proportion of patients which were satisfied by surgery type B, and you will compare the proportion of patients who are satisfied in one group versus the other group. You will use chi-square test. Now, for example, just the same example, somebody might be doing this study, and the satisfaction level that they are using 1 to 5 scale only, similar that in the earlier example we were using. And in that 1 to 5 scale, they are using it as scores 1, 2, 3, 4, 5, and then they are taking mean scores. If the researcher intends to use the satisfaction level scores, mean scores, and compare it between the two groups, then you are using the satisfaction level scores as continuous variable, and then you are comparing means, and then you have to go towards the t-test side. You have to go on the right side of the algorithm that I showed you. So it is important that when you are writing the protocol, at that time itself, you must be clear in what way you will be using satisfaction level. Whether you will be using it as a categorical variable, or whether you will be presenting it as a continuous variable, scores. If you decide at the protocol writing stage, later on it is a cakewalk. But I see at times we don't write it at that time. We just write satisfaction level will be compared by appropriate test that will be there. And then later on we try to do this and that and see kahan p-value aa raha hai, nahi aa raha hai. That is unethical. That is not the correct way of doing a study. So that is why this is a very good question, because it is an ordinal data basically. So ordinal data can either be used as presented as a categorical data if you take some cutoff, or it can be used as a continuous data.
Like, sir, if there is a functional score, usually in most of the functional scoring system, it is divided between 0 to 100. And what value we are getting, if we categorize it, then it becomes ordinal data from continuous one, sir. Yeah.
Yes. So if it is 0 to 100, usually, if it is 0 to 100, and if you are having some predefined cutoffs.
Yeah, like, sir, for satisfactory level, usually we take above 80 is satisfactory.
Right. So if it is above 80, so you are introducing a cutoff. The moment you introduce a cutoff in any scores or in any measurement, then you are categorizing it. A cutoff will categorize. So that will be in the algorithm. We will be going towards the left side of the algorithm, categorical data, and then we will be using chi-square. If you are not using any cutoff, the raw values are used, whether it is 70, 72, 80, 30, whatever. You are using all the values and finding out mean score in this and functional assessment ka mean score in other, then you are using it as a. So if you are not applying cutoff, then it is a continuous variable. You are using it as a continuous data.
So there is one question in the chat box that need of control group if we compare the outcome of any result before and after intervention or surgery. Is there any need for control
before
group?
And after
The surgical procedure or any other intervention?
Can you repeat the question? I am not able to see the chat box here. Okay.
So the question is about the need of control group if we are comparing the result, means the functional outcome of a surgery and before that, means before intervention and after intervention.
Yes, that's a good question. So before intervention and after so you are doing a surgery. So there are some patients that you will be operating upon. Yeah. You are doing some assessment. The outcome is there. Functional assessment. Some outcome is there. So you are what you are doing is suppose you are operating 30 or 40 patients. So before the surgery, you are assessing their functional status. What is you are doing some assessment and writing the score for each patient. And then at the end of the surgery, after the surgery, you are again measuring the functional assessment. You are doing that and measuring the scores. Now, in this case, the first thing that you have to decide is whether this particular functional assessment score that you are getting, whether you are using cutoffs or not. If you are using cutoffs, then you are considering it as a categorical variable. Okay. And before it, and if you are not using cutoffs, then you are using it as a continuous variable. If you are not using any cutoffs, you are just using the mean scores, then in that case you are using it as a continuous variable. And before after study, if you want to compare continuous variable, then you are comparing the mean before and after, and it is a paired type of data, so you will be using paired t-test. If you are saying that you will be you are applying a cutoff, in that case what happens is that the category, you are using it as a categorical variable, and whenever there is a matching before after is a paired data, right? If there is a paired data, then you don't use chi-square test, then you use what is called as McNemar test. So that if it is, so the basic thing, Dr. Janki, is that if you know what type of data is this, how are you going to use that? What you are comparing, what is the type, whether it is continuous, you are using it as a continuous or categorical. Then you know that whether it is paired or not paired. And if you find that it is paired, then you can see any algorithm. In many textbooks, the algorithms are there. I have given the shortest algorithm that is there for ease, but you can, the algorithm moves on further. But if you know the basics, you can move on in the right direction and decide. So if it is categorical data and if it is paired, because it is a before and after, then you will be using the McNemar test. And most of the statistical software, they will give you McNemar test also. That's not a problem.
So there is one more confusion about when we are preparing the protocol, the thesis protocol, that time about the sample size. Usually during our last meeting also for the ethical committee, it is said that the sample size should be more than 30. In few literature I have searched, it is written like if it is more than 100, it is okay. So sir, like few of the rare surgery which is performed even 2 or 3 cases in a year, and we are giving some retrospective study. In those cases, sir, is it also needed that the sample size should be 30 or the lesser than 30 is okay?
First thing is that whenever you have to write the number, the sample size is basically a number, how many subjects or participants you are going to enroll in your study. It should not be an arbitrary number.
Yes.
There should be some logic, some rationale behind that. For example, we see at times students writing that because we think that we will only 20 patients will be coming to, we will be able to do only 20 patients in 1 year, so we will be considering the sample size as 20. That's all. Or they write that whatever the number of patients that will come to our OPD or this particular OT for in the coming 6 months, that all of them will be included. That will be our sample size. So, or some people, they mention that because in the earlier study sample size was 40, so I will be also studying 40. These are all not correct way of sample size estimation. Sample size estimation should have a logic and it should have a statistical background actually. What happens is if you are comparing to some variable, you are comparing in the two groups. That is the most commonly that I see in orthopedic surgery also being done, that you compare certain aspects, or you find out what is called as agreement between inter-observer agreement, that there are x-rays or there are CT scans and you are trying to diagnose a particular condition based on that. So there are consultants who look at it, there are residents who look at it, and then you try to find out the this inter-observer agreement and all. So whatever objectives you have for your primary objective, so that is another thing, that when you have to find out sample size, always look at the primary objective. And I always recommend that keep one objective as primary objective. Don't keep 5 objectives as primary objective. So one primary objective you keep and calculate a sample size based on that. So if you have if you want to compare mean between the two groups, maybe surgery A, surgery B, and you want to compare some functional assessment scores in this group and that group. So you will have to know that what are the estimated mean and standard deviation in the functional scores in group A, surgery A, and what is the expected mean and standard deviation of the functional scores, assessment outcome scores in group surgery B. So this you will have to have an estimate. So all your sample size for calculating any sample size, Dr. Janki, the researcher must have an estimate. If the researcher does not have an estimate, then you cannot calculate the sample size. Now, from where do you get the estimate? You get the estimate from previously published studies. If previously published studies are not there, then you have to look at hospital records. If there are some studies, some surgeries done and some case sheets are there, from that you can get some scores or something that you can use for calculating sample size. Or if it is not there, then if you can find out some mean and standard deviation in the 1 or 2 months, the surgeries that are being done. So see 5 or 10 patients, what is the mean functional score in group A, and those who are other type of surgery, try to 5 or 10 patients, and you see what is the mean and standard deviation. Just an estimate, you should have an estimate from a few patients. So either you get it from published studies, or you get it from your hospital records, case record forms present in the hospital, or you get it from, or you generate some data from your own setup, and that can be used an estimate for doing that particular thesis or particular research. So this method, that saying that in other studies the sample size was this, so that is appropriate, and we also will be using the same sample size. That is not the correct way of writing sample size. Lastly, I would like to add that you always calculate sample size first for the thesis protocol. You write that the thesis, by calculating the sample size in the 2 groups, we found that the sample size has to be maybe 65 in each group. Suppose you get this, you write it. You don't worry, you write it. And then, but you know that in thesis is of 1 or 2 years, the data collection period is not infinite, or you cannot have it on your own will. It's a thesis is a time limited task. So, and resource limited, only one person has to do. So what happens is, then you can write later on in that sample size section only, you can add further that even though the calculated sample size is 65 in each group, but because it is time bound thesis, and in 1 year in our hospital we are going to get 25 patients or 30 patients or 32 patients. So we will be considering, this particular, for the purpose of this particular thesis work, we will be studying 32 patients or 25 patients as the case is applicable. But that will always be an add-on. The students, why we don't directly write this? The reason is, then the student throughout their lives, they only think that is how you write the sample size. That is not correct. Even when they have to do research, funded research later on, they don't know how to calculate sample size. So it is important that when the students are writing their sample size in thesis protocol, they calculate the sample size, having based on some estimates and the statistical background, and then they write the sample size, whatever it is. It may be 100, 200, 300. And then if it is not feasible, then you add on to that, and you write that it is not feasible in this thesis, only this. That is perfectly okay. At least the student learned that is what is the correct method, but because of this limitation, you are using the sample size. Is that okay?
Yes, thank you so much. So one more thing which I want to know, that like when we are writing some thesis or even for publication, it is said that there is some thing to register to some centers. Can you let us know the details about that? Like to start a study or to start a research, is it for every study we have to register to some centers, or?
Yes, that is right. There are two types of studies, basically observational and interventional. If it is an interventional study, if it is a trial, then it must be registered. So you have a Central Trial Registry of India, CTRI. I think it's under ICMR. Yes. So CTRI, you can check the website, and there all the information has to be entered before. So that is all. That is all that has to be done. You just put it asks you what is the primary objective, what is the outcome measure, what is the title, what is the sample size, some basic information, and that is there. The reason why it is important is what happens is people, they do interventional studies. If they find it that it is significant, the difference is significant, they will publish it. If they find that it is not significant, they will not publish it. So what happens? We get a biased picture. If all the interventions are registered, so suppose if I see that on a particular topic, there are 100 intervention studies registered in that database. And I check the publications after some time, and I find that only 5 have been published. They're all significant. 95 have not been published. So and also that CTRI, the database, I think you have an option to add results also later on. So even the study is not published, but if the results are that, I can see from there how many interventions did not find out a significant difference. So that is why it is important that and another thing is that interventional studies, we find that most of the times, not for the thesis work, they are not funded, but interventional studies are mostly funded, whether it is vaccines or drugs or type of surgery or type of implants and so on. So they are funded studies. And there are chances of conflicts of interest, and the researchers and those who they are working with might change something in between. Like they say that we will be doing this, measuring this outcome, but later on they find that that outcome is not significantly different in the two groups. Then they will say, okay, let us check for other outcomes, and they find some other outcome significant, and then they start telling, see, and then they publish that, okay, see, this is what we have found, this outcome. But that is not what they started with. So they are changing the outcomes at the end of the race. You can't change the rules at the end of the game. That game is not fair. The rules of any game must be decided a priori, must be clear to everyone a priori. Then only that game is said to be fair. That is why the protocol is the rules of the game that you are going to play. So that thesis, what are the rules by which that thesis, that research will be conducted? Those rules must be mentioned beforehand. That is why it is all mentioned, sample size and everything, 2 groups, how you are doing the randomization and all those things. That is all mentioned in that protocol, so that the chances of changing the rules of the game in between or at the end of the match is minimized, and fraud is not there.
There is one question in the chat box by Dr. Sachin is about the correlation. What is correlation, he's asking?
Yeah, that is a good question. Correlation, I didn't touch upon it because I keep some points depending upon what the questions are going to be.
Yes.
It's important to be guided by the participants. So correlation, first of all, I will say what is not a correlation, because I'm continuously still see students writing that we will to find the objective is to find the correlation between this and that, but that is not actually what they're writing, is not actually a correlation. For example, correlation between satisfaction and type of surgery. Suppose that is the primary objective. I'm not writing which surgery, type of surgery A and B versus B, and satisfaction level, satisfied or not satisfied, satisfaction level. Okay. So when I asked the student, then they say that yes, I asked them further, you have mentioned to find out the correlation between satisfaction level and the type of surgery. So I asked further, what is this satisfaction level? Then they say that we are using cutoff of, we are using a 5-point Likert scale, 0 to 5, and more than 3 will be considered satisfied, and less than or equal to 3 is not satisfied. So we will be comparing what proportion is satisfied in this and what proportion are satisfied in the other surgery group. Now, this is here they have written correlation to find out correlation between satisfaction level and type of surgery. This is wrong, because the satisfaction level that you are seeing, that is a variable, satisfaction level, and that you are using it as a categorical variable. And type of surgery A and B, that is a categorical variable. You have two categorical variables. Correlation, the term correlation must be used only in case when the two variable between which you are seeing the correlation must be continuous variables. You can check the correlation between hemoglobin level and BMI, because these both are continuous variables. You can check the correlation between the satisfaction level and age, because satisfaction level scores and age is also continuous variable. Satisfaction level scores are also continuous. You can find out. So whenever you write correlation, always see that the two variables that between which you are seeing the correlation, are those two variables continuous variables or not. If not, don't use the word correlation. Actually, we use the word correlation in a loose sense, the day-to-day meaning of correlation, whether they are, the actual term that should be used here is association. The example that I gave when I said that to find out the correlation between satisfaction level and type of surgery, the actual word that must have been used here is to find out the association between satisfaction status and type of surgery, rather than saying correlation. Correlation is not right in this case. Association term must be used in this case. I hope it makes sense here.
So I think, thank you very much, sir. It was very rich, and I think most of the questions we have covered. Still, there are many questions which is not yet covered in this lecture, like as you told that it is about the how to select the statistical test. So other classes what you have guided us. So according to your time, we can plan, sir, and according to our chairman. Yeah. So, sir, I think most of the difficulties what about selecting the statistical test is now, I think it will be less for the student also and for the researchers also. So thank you very much, sir. And
thank you, and thanks to all those who participated also, and thanks to John sir also.
Yes, sir. Actually,
okay,
yes.
Thank you. Bye.
Yeah, thank you so much, sir.